Hi, welcome to Brain Rehab channel. I'm Dr. John Hatch. Today we're going to talk about one of the most controversial things that I have found in functional neurology, chiropractic neurology, neuroscientists, neurologists, and that's the topic of vertigo. It seems like it's the most simple thing there is, and yet for some reason I seem to treat it way differently than the rest of my colleagues, the people out there, and I wanted to figure out why. And so I've really devoted my time and effort to trying to understand vertigo and dizziness. A lot of you have dealt with this personally. If you have a loved one, they're going to want to hear this because I'm going to teach it from a simple standpoint. The research shows that most vertigo or dizziness, we'll just put vertigo and dizziness as the same thing, even though they might be a little different, right? You can have dizziness from low blood sugars. You're not going to have much vertigo from low blood sugars, but you might have vertigo from stress. You might have vertigo from lack of nutrients, right? There's other variables going on, but vertigo and dizziness, this most is what we call BPPV, and that's benign paroxysmal positional vertigo. And as most of you have known, this is the world that we live in. Everyone says, okay, you got crystals inside those ear canals, and that's been jarred inside your inner ear, and they float inside the canal, and then they bump this little receptor that then tells your brain you're moving, gives you all this mixed information, and it makes you usually wake up and it's like, boom, it's just vertigo hits, or you hit a position and it hits. And these are usually the crystals in the canals, and you usually fix it with a simply Epley's maneuver. Okay? And the Epley's maneuver, it's very specific. It's on all the YouTube videos. You can watch it, try it on yourself, go to your local ENT. They'll know how to do it perfectly. Most of the chiropractors are trained in it, physical therapists are trained in it. They know how to do this Epley's maneuver specifically to get the crystals out of the canal. That's one. Most of the patients that come into our clinic have done this route sometimes 4 to 5, 10, 20 times. And it's not changing their vertigo. They're in a state where they've felt dizzy or nauseous or vertigo and it spikes at different times, or for some it's constant, and they have mal-debarkment syndrome. And if I spell it wrong, I apologize. Mal-debarkment syndrome. And that's where you have land sickness. You get off a boat, you get off of an airplane, and you feel like the world is spinning and it never stops. Then you have a lot of other things that can cause vertigo and dizziness, right? You can have cranial nerve damage, head trauma, traumatic brain injury, right? Sometimes that could be a stroke. Sometimes that could be a concussion. And then you also have Meniere's syndrome. Oops. And these causes, there's hosts of problems that could be going on with either one of these. So when we have heard from my many colleague friends, ENT and audiologists, I've learned how the system works, and there's also different receptors that are going on within the brain to understand it even more. So I wanted to explain this to you as we discuss these symptoms and issues with vertigo and dizziness. And if you haven't watched the one on headache, you should watch the one on headache. You'll get a lot of information that's similar to this one. This is just, instead of a headache, we're dealing with vertigo or dizziness type of symptom, right? So for those of you who don't understand, this is just a simple brainstem, and then you have your cerebellum on the back. The brainstem's broken up into 3 areas. You have your midbrain, you have your pons, and you have your medulla oblongata. Now these 3 areas are really, really important to understand your brainstem, how it functions, how it works, and also to understand what the cerebellum is doing. So you have these 3 peduncles that connect to all 3, and they're called cerebellum peduncles. It's just how the organs communicate one to another. And the sensory goes into the cerebellum and comes out. This one's mostly all in, and this one's mostly all out. There might be a little trickle through there. There's a bunch of research that says it's more this or more that, and so just for general understanding, most of the output is up here in the superior, most of the input is here in the middle, and then this one kind of sits with a more input than output, but does have some output as well. And everything's ipsilateral. Now what you might say, ipsilateral, let's just think same side. If I'm moving my fingers on the right side, that's the right cerebellum. The right cerebellum communicates with the left cortex and vice versa on the other side. So when you draw this brainstem back out, and then you have the cerebellum on both sides, and you have connections at all three levels. And this is really important because the information, there's not many areas that it crosses over until you get into this upper area. This is where it crosses over, okay? But this side is you have your vestibular system, super important, and your vestibular system on the other side. And the vestibular system is very important because it's an outside organ. We talk about it a lot when you have your awesome ear, you have your eardrum, you have your then 3 bones that then connect to the cochlear, then you have your vestibular apparatus itself that has the 3 canals and the otolithic system. This is where that BPPV comes in that we talk about here. And then these two together make up cranial nerve 8. And where do they go? They go here. So right side goes into the right. Left side goes into the left. So when you have a sense of vertigo or you have a sense of the world spinning, the question is, do you have an end receptor problem, which is this? We're going to call this the receptor, an end organ. We're going to call it end organ receptor issue. Or do you have a central integration issue? And a lot of people, barring the BPPV with the crystals in the canal and the Meniere's, because the Meniere's is out here when your perilymph and endolymph get mismatched between the sodium and potassium here. The rest of the stuff all usually integrates. BPPV is obviously the crystals inside the ear. So let's just color coordinate this. Meniere's down here. BPPV will be the crystals inside the canals. And then the rest of this that I see very obviously cranial nerve, we can put this cranial nerve could be damage to this, right? Hearing loss can create dizziness and vertigo because it damages the cochlear nerve, right? The cranial nerve 8, the vestibular cochlear nerve, is a combination of both the vestibular apparatus and your hearing cochlear. So a lot of people with hearing losses will create vertigo issues and imbalances. And the question is, can your brain adapt? Now, I think that's the question that needs to be answered because so many people have come in and said, oh yeah, I lost my hearing and I'm fine. Or I had a tumor on my brainstem, I had surgery, and after the surgery I've had massive issues with balance and vertigo. Or I've removed my entire vestibular cochlear apparatus on the right, or clipped the cranial nerve 8, and I'm now having dizziness and vertigo, but yet there's no receptor there. Now the cool thing about this system is it doesn't just go one-sided. When you get input into this right side, it has a reflexive system that inhibits the contralateral side. So you can activate both systems individually from one side, but is that system imbalanced? And what I find, especially with maladebbarkment syndrome, with traumatic brain injury, strokes, and concussions, what is going on in this central integrative system? How well is your system balancing it? Because from this end organ, it's just giving input. How does your brain process this integration in here is one of the most important things that I've seen in people with vertigo and dizziness, and it all comes down to the healthiness of your cerebellum. Your cerebellum is a huge organ that, again, houses 16, like 50, well, let's just do the math. 69 billion neurons exist in here, and in your awesome cortex, you only house 19. 50% of the integration and neuro input all happens in this amazing thing we call the cerebellum. So the question is, how is your cerebellum doing? And with patients that have dealt with Mal-de-Barkman syndrome, even damage to a cranial nerve, traumatic brain injury, stroke, even Meniere's disease, right? You can have complex issues that can still be integrated and decrease the amount of vertigo and dizziness. And so the question is, what part of your brain is working or not working? A lot of times you'll hear like even wax, compaction wax inside your ear can make you feel dizziness and vertigo. If you've ever done a caloric test, a lot of people ask about calorics, where you put water temperature, cold water or hot water, and you put it in your ear and it makes you go into a massive imbalance. That's also a diagnostic test. We use that neurologically to see, is this heat or is this cold, and there's a certain connection reflexively to your eyes. And your eyes always want to keep your balance. And so if your vestibular system's pushing your eyes in different directions, you're going to shift your body in position to try to make you feel stable, and that can lead to vertigo, headaches. And that's why people start to feel really nauseous and then they vomit, right? They get to the point of nausea so bad that they vomit. So my question to you is, what are you doing with the integration of the cerebellum and its balance between the vestibular system? This system is so intertwined, and there's specific diagnostic tests you can do around those areas to make an improvement so you don't have to deal with dizziness and vertigo. We've seen some incredible cases of patients walking in and they walk with a cane, or they can't walk without assistance, and when you activate that brain correctly, all of a sudden, bam, brain completely stabilizes and they can move and adapt the way the brain's supposed to. So if you have a loved one that is dealing with this and it's been too long and they've tried everything, a lot of the over-counter drugs for this is just your standard Dramamine or your other like local stuff. There's not much to this medically, but there is a ton when it comes to rehabilitation of the brain. That's why concussions usually deal with this constant issue. And so the more you can rehab your brainstem and your cerebellum, the less vertigo and dizziness you have for you.